Can I really very warmly welcome everybody? This is quite an exciting day for me. Kesh and I have talked for some time about the opportunity of formally signing a memorandum of understanding between Cwmtaf Morgannwg University Health Board and the British Association of Physicians of Indian Origin. And for me, though, actually formalising this and signing it is important, but actually it's the thought behind it. That actually this is us as a health board really recognising the contribution of the physicians of Indian origin, but also other BAME doctors and also our wider BAME staff, how fantastic that contribution is. And us really wanting not only to recognise it, but commit to work with you to do the right thing, but by that important group of our staff. And also use all the opportunities we have to recruit and to work together more effectively. And behind the scenes, there's work in looking at how we can support more vulnerable members of the BAME community, and some real tangible examples that this isn't just a ceremony and a bit of paper that will be lost, but it marks a really effective way of working together. So some of you will have seen the agenda, and I'm very privileged to have the Minister with us, joining us today. Thank you very much for joining us, and we'll ask you to say a few words later on, just in case you hadn't seen the agenda. But can I hand over to Kesh, because I think you wanted to say a few words before we hand over to the Minister.
Thank you very much, Nick. Baroness Morgan, Minister for Health and Social Services, Chair of Cwmtaf Morgannwg, Nick, who's the MD and Deputy Chief Exec, President Ramesh Mehta, and colleagues. This pandemic really laid bare the various inequalities in our society, and it's all the more important for us to now consider fairness, equity, equality, diversity, inclusion. And I'm very proud to say in Wales we have been ahead of the pack by a long mile. And in fact, with the Race Equality Action Plan, I think Wales has probably taken the most radical steps in bringing all these issues out in the forefront. But BAPIO or BAPIO has been at the forefront of all these for the last 25 years. And I think we've had a lot of success in various campaigns, like the highly skilled migrant program visa rules, which we managed to get a court ruling in favor of the affected people, the Bawa Garba campaign more recently, the campaign on differential attainment, and now, of course, the various contributions to REAP. And BAPIO is, I'm so proud to say, is a very constructive body. It's not just highlighting problems, it's coming with a solution. So we are collaborating very heavily with the GMC, the Royal Colleges, Health Education England, and Health Education and Improvement Wales. And on that front, the recruitment scheme that we had started with the encouragement of the then Health Minister, Professor Mark Drakeford, in 2016, has already saved £20 million in locum costs to our NHS. And apart from that, it's brought a lot of bright young candidates over who have done their 2 years and have then gone back to give back to their country of origin their newly acquired skills. So the 4 pillars of this MOU we are signing today are to, number 1, promote equality, diversity, and inclusion. Number 2, to work jointly in raising staff morale. Number 3 is to develop relationships which will assist in early conflict resolution. And from my point of view, that is the closest one to my heart, because a protracted investigation doesn't do anybody any good. Not the organization, not the affected person. And most of these are he said this, she said this, and so on. And I think we can actually bring that to a informal resolution in most cases. And fourthly, the 4th pillar is collaboration to recruitment and retention. And Cwmtaf Morgannwg has taken the lead. In fact, this recruitment business I'm talking about, Nick, was actually led by Cwmtaf before you had joined. And I think that's a great opportunity. And on that, actually, BAPIO has become a recognized GMC sponsor for registration. So we can now sponsor overseas candidates directly for GMC registration, and that cuts out the waiting time for this paperwork from 12 months to 3 months. Now, just to close, I would say CTM has been very, very proactive in setting up this BAME network. And I think it's a real testimony and to the vision of our leaders. That's you, Nick, Marcus, and Paul Mears, the chief exec, in actually recognizing these issues way on early on and putting a platform, the BAME network. And I've had discussions with Raja Biswas and Ash Wagle, both of whom are leading the BAME network. And we know we are going to work very closely together because what we are desirous of is the same thing. We're just working in slightly different spheres. So I think we will complement each other's work. And on the nursing side, Kokila, who's the lead for BINA, the British Indian Nursing Association in Kamtaf, BINA is arm's length body of BAPIO. So BINA, the BINA in Wales was launched at our conference on 30th of January. And I'm sure with Kokila also on the nursing side, we'll be working very closely. So I'm very grateful to you, Nick, Marcus, Paul, and the whole management to work with us so proactively in sorting out these issues. And I'm sure we'll make not just CTM, but NHS Wales a much better place for all our staff and thereby for all our patients. Thank you very much.
It's a delight to work with you, Kesh, but also, it's a very genuine and real commitment from the Health Board to make this working together effective and to really be doing the right thing, as you've been describing. I'd like, if I may, then, to invite the Minister to give us a short address. We're very privileged to have you here with us this afternoon, and perhaps I can hand over to you.
Well, diolch yn fawr, Nick, a diolch yn fawr i chi gyd am y gwahoddiad. Thanks very much for inviting me to attend this celebration. This is, I think, my first proper event as the new Health Minister. So I'm very delighted to be doing that with you in Cyntaf, and in particular to really pay tribute to the incredible work that BAPIO has been doing over so many years. So first of all, thank you for everything you've done over all of those years. I think you've been going since about 1996, and I've been tracking your development since that time, even when I was a member of the European Parliament. I think I came to an event that you hosted then. So I'm really delighted to be here with you for this MOU signing. I think that the work you have done over all those years, but in particular over the past year, has been incredible. It has got to be one of the toughest years imaginable for anybody who works in the health sector, and I just want to pay tribute to you and to all of your colleagues who've worked so hard during this most difficult time. I'm particularly thankful and appreciative of the role that BAPIO has played during that time. I think this medical training initiative is an excellent initiative. It's clearly paid dividends already. It's delivered, and I think that's one of the great things. Quite often in Wales, we're looking for some leadership. We're looking for people to take the initiative, and the one thing that we know with BAPIO is that you're just going to get on with it, and you do deliver, and that is just so heartening, and it doesn't happen all of the time. So congratulations on not just having an idea, but delivering on the idea, which is so important. And I think that the fact that you've got this initiative when it's mutually beneficial, and I think this is why it's so key. I think we all feel very uncomfortable about going and poaching people from countries where they clearly need that support in their home countries. But if they're coming here and they're getting the training that they need, that they can go back and share then, and we're benefiting from their contributions while they're here, then everybody wins. And I think that's why this is such a great initiative. So I know you've done about 4 recruitment campaigns already in India. I think Vaughan Gethin has been involved in one of them. I know he loved his time going over there to try and bang the drum on your behalf out there as well. But I'd also like to thank Kesh, who of course is a legend in Wales, if we're honest, for the incredible work and the contribution you've made in helping us in particular with our Equality Action Plan. I think we are very aware in the Welsh Government of our vision to create a country that is not just intolerant of racism, but is anti-racist. And there's a big difference. There's a big difference, and we need to challenge racism, and we need to make sure that it's about outcomes, not just about not being racist. It's about making sure that we deliver and that we don't see discrimination. And I think that action plan that I know you've all been very helpful in helping us to co-construct and to develop, we hope that will have a genuine influence and change in terms of the way ethnic minorities feel treated in Wales and very much appreciated, because that's certainly what we're looking for. So thank you very much for your help in identifying the goals and actions, in particular that health boards need to follow. The HEIW, certainly Welsh Government policy leads, I know, have been really appreciative of your guidance in this area. And thank you also for the work you did on the risk assessment tool at the beginning of the pandemic. We were all very concerned about what was happening there, and the speed with which you turned that around was really quite phenomenal. So thank you for that. Now, we've got lots and lots of challenges ahead. COVID is not over, I'm afraid, and it is very concerning to see the Delta variant now rise, and I think we've got to understand this is not going away anytime soon. We're going to have to learn to live with this, and so we will be looking to you to continue with that leadership role that you have been giving to help us to clear the enormous backlog of work that has built up during this time. And I just want to finally end by thanking Cwmtaf also for your initiative here in making sure that you are driving this agenda forward. And I do think this is a tremendous initiative, and I hope it is something that will be duplicated across Wales. Diolch yn fawr.
Diolch. Thank you very much, Minister. Thank you for joining us. Thank you for your wise words and your encouragement. And I just want to, echo the inspiration and the commitment of Kesh and colleagues over the last year has been truly humbling, day in, day out. And it's been a privilege to be in the health board during such a challenging time, but seeing the very best of the professions. So thank you so much. We now come perhaps to the most important bit, but the bit that online is perhaps the trickiest. So how do you actually get 4 people to sign a document online and virtually? So Kesh, I think, has an idea, as always. So I'm going to hand over to Kesh, and you're going to guide us through how we actually do this signing ceremony with such a prestigious and exciting audience.
Thanks, Nick. So here's my copy of the MOU. I think we've all got a copy. I'm going to sign mine. And I think Hasha is going to sign on behalf of BAPIO as well. Has, can you show us your signature? And then, Nick, we are going to send this over to you for your and your colleague's signature. And then we'll finally collate the copy and send it to our president for locking and keeping in the safe.
Thank you so much. So I also have a copy. This is about as smooth as we can make it happen virtually. And the health board will then also be signing. And yeah, isn't that exciting? We've talked about it for so long, Kesh, but now it's actually signed, or effectively signed. The commitment is there, and this is the start of another stage in a really exciting journey. And I look forward to being a part of that. We're lucky here to have, very privileged again to have Marcus, our chair. So perhaps, Marcus, I could hand over to you for a few words. It's a delight to have you with us.
Thanks very much, Nick. And Minister, colleagues, lovely to have this opportunity, really, of further cementing a relationship that goes back now several years. I was just reflecting, so you must be about 25 years old in BAPIO, and we as a health board, we're just a whatever it is, 12 years. So, you know, we're a sort of gauche teenager compared with your sophisticated person of the world. So we approach this with suitable humility. I think the 4 pillars of this arrangement are really important, aren't they? I'm not quite sure about the metaphor, how this works, because in a sense the pillars are all interconnected, aren't they, really? They're not separate entities at all, because achieving improved morale, for example, is all about the other 3 and so on. And that's a really powerful arrangement, I think. We in the Health Board have got over 900 staff who are from a whole variety of different backgrounds and ethnicities and so on. So that's a huge element of the Health Board's lifeblood is that diversity, which is a massive strength. But it can't be taken for granted. You know, that's one of the things that we've learned, I think, during COVID, isn't it? That if we take our staff for granted, then it's patients who suffer. So there is so much that we're going to need to do now, I think, coming out of COVID. The staff I talk to every day show a mixture, I think, of tiredness, weariness, but also, I think, slight bewilderment and disorientation, really. This has been such a peculiar 15 months that very few people have quite processed yet what it means. People have seen suffering. Many people have seen suffering in excess of what they are anything like they're used to. It's affected people at home equally as at work. And all of those other pressures, I think, have had a huge impact on our workforce, which we probably don't really understand yet. And the way to get through that is by working together. And working together with BAPIO is just a fantastic way of doing that. We as a health board, I think, are and must be approach this with humility, and very much in the space that we need to learn what it is that our staff need from us to support them. So this is a fantastic opportunity to do, I think, just that. There are real signs of improvement in Cwmtaf Morgannwg, which are really encouraging. We've had a difficult period leading up to COVID, and then obviously with COVID, but things are definitely improving now. There's lots more to do, but we're going forward, I think, in the right spirit. So it's great that we can have this relationship with BAPIO. I think, Kesh, rather than locking it away in the safe, we need to have it on our desks in front of us and remind ourselves periodically what it is that we're committing to this Thursday afternoon, and, you know, to hold ourselves nicely to account to make sure that we deliver it. So thank you to everybody who's been involved in pulling this together, and I would pay tribute, I think, to colleagues before us as well who have done so much to bring this relationship to the point that it's at now. Thank you very much.
Thank you, Marcus, and the communications team are here with us today to actually share the words that we've already heard, and actually that's part of the holding ourselves to account to make sure that this isn't just a ceremony that is then forgotten, but this is that very real and genuine commitment. I'm going to ask Ramesh Mehta, the president of BAPIO, to share a few words with us now. Ramesh, your reputation goes before you. I've had the privilege of working with BAPIO in a couple of places in England and also in Wales, and the difference BAPIO makes to the NHS is incalculable. And it's really quite exciting to meet you, and look forward to hearing what you have to share with us.
Thank you very much, Nick. Much appreciated. You've been very kind, very kind. Can I start by thanking Nick, Marcus, Paul, and the team, and welcome the Minister, Baroness Morgan. Minister, you know, I've been coming to Cardiff over all these years, and I've been meeting members of the government. But you know, what you said just now is so impressive for me, that you've been following BAPIO since your days in European Parliament. And you know what you said about Kesh as a legend is absolutely right. Hasmukh is also equally, and we got top class team, including Viju there. Ma'am, you know, BAPIO, there are 65,000 doctors of Indian origin working in United Kingdom. Large number of healthcare workers, especially doctors in Wales, are of Indian origin. But we believe in equality, diversity, and inclusion. So we are not just looking after doctors and nurses of Indian origin, but all healthcare workers. And we are committed to ensure that we are not just for Indians, but for all the healthcare workers. I just wanted to very briefly say how useful BAPIO has been to the National Health Service with our family. I call it BAPIO family because we have 5 other, we call it arm's length bodies. The Medical Defence Shield looks after the doctors in difficulty. BAPIO Training Academy looks after training and education to ensure the excellence, clinical and professional excellence amongst the professionals. We have BAPIO Institute for Health Research, and during COVID times, we have been very, very active, including Keshav producing the risk assessment tool. We also have BAPIO Faculty of Leadership. And I think Marcus mentioned how important is leadership. All the doctors and nurses and healthcare workers, they should be leaders. And this would eventually improve the patient care. So with this BAPIO family at your service in Wales, ma'am, and you being the health minister, I am sure that we can continue not only to provide the top class service, but continue to improve upon it. I'm grateful to all the management and the staff in the health service, health board, and I look forward to meeting you all. And let me extend the invitation at this time for our Silver Jubilee Conference, which is going to be in Birmingham, unfortunately not in Cardiff this time. And it would be really good. We are hoping that by then COVID will be under control with the vaccination, the way it's going and the rate with which it's going. Hopefully we should be able to meet face to face. We look forward to welcoming you. And once again, thank you very much for this collaborative effort. And I'm pretty sure that this is win-win situation for the health service. Thank you very much.
Thank you, Ramesh, and I'm absolutely sure that a win-win situation it is, and I really look forward to meeting you personally, rather than just in this slightly artificial environment of Teams. Can I hand over then to Sarah Mosley? It's lovely to have you with us also, Sarah, as head of the GMC in Wales and a board member in Cardiff and Vale University Health Board. And I have to admit, they have already signed an MOU with BAPIO. But Sarah, perhaps welcome, and perhaps you could share a few words with us.
Yes, diolch yn fawr am y gwahoddiad, and it's lovely to see you all. And thanks in particular to Keshav, who has been really involved with the GMC in Wales, as I know has Ramesh at GMC UK. And it's the kind of the leadership, it's the statement of intent, it's about how we want to behave and how we want to move forward. That's so incredibly important about today. And as you say, Cardiff has signed it, and I caught up with Stuart and Keithley there. And we know that what this does is it reinforces a way of behaving and interacting, which is really transformational and changes the way that everybody thinks about what's going on. And you all know the GMC is an independent organisation. It's a registered charity, and it exists to protect patient safety and to improve education and training. So that includes, of course, as Marcus said so very eloquently, caring for the carers who provide that medical support, because there is no safety, there is no progression, there is no improvement unless the individuals who are at the heart of this, the doctors who are at the heart of this, are also cared for and included. So it's incredibly important, and it's very kind of close to our heart as an organisation. And you know, all of you here know that we set standards, we decide who comes onto the register, that we look at improvement in education, and that means that we have an awful lot of information about what is actually happening within the medical profession in the UK, and we've reflected on that. We've assessed that. We've looked at the patterns of what is happening, as so many of you will know, and we also have to. We want to work with other people, which is why they work with BAPIO and with the local health boards, with you, Nick, and your fellow responsible officers is so incredibly important. And there is a fantastic environment in Wales, and we met a few weeks ago, which is where Keshav and I first came across each other, with the chair and the chief exec of the GMC, and we had a discussion around equality, diversity and inclusion in Wales, and the energy and the focus that the Race Equality Action Plan has brought is really tremendous, and there is some reference in there to some of the GMC's figures. But I just wanted to take us back to, I was just looking at the register, and if we look at new entrants to the register last year, a majority, 61% of new entrants to the register were overseas trained doctors, and that compares to 44% in 2017. So that proportion is going up. So it's hugely significant. And in Wales, 27% of all licensed doctors are international medical graduates. So it's just absolutely fundamental that we do everything we can in terms of the well-being and the inclusion and the fairness and the diversity of the workforce, because it's the reality of what we are in Wales today, and we need to support that. So despite that really wonderful, welcome, vibrant diversity, if you've been trained overseas as a doctor, you are more likely to be referred for fitness to practice, and you are less likely to reach attainment targets in terms of education. So if you come from a Black or minority ethnic group, you're twice as likely to be referred to us by your employers as white doctors, and doctors who didn't qualify in the UK are 3 times more likely to be referred than others. So the whole issue of what we're doing now is absolutely crucial. And what we've done is reflect on those figures. And there are some things which people have talked about in this meeting which are crucial. So induction is really, really important. Welcoming people to us in a way that promotes understanding, a feeling of belonging, a sense of knowing where you are, knowing that you're valued and cared for, and a sense amongst the whole organisation of what this sort of diversity means and what the cultural differences are. So we already work really closely with a number of you, but we're very keen in the GMC to do more. And we've just set some targets, which are very ambitious targets. They're not going to be easy targets to meet, but they wouldn't be worth it if they weren't difficult, which is about getting rid of those differentials that I talked about earlier. And that's going to require all of us to work very closely together to think about how we get in early to create the conditions where everybody can thrive and everybody has psychological safety and safety in terms of the way that they work. So I think it's fantastic to see this happening, and I've seen in Cardiff, you know, how it's a basis for doing so much more, and a kind of a pathway for all of us. So great to be here today. Keshav, thank you very much for inviting me, and I'm just so looking forward to working with all of you. And if you see anything, if you hear anything, if you have any ideas, if you need anything from us, then please, you know, be in touch, and we're here.
Thank you, Sarah. Thank you for joining us. And can I also just acknowledge and celebrate really the interest the GMC has had in the welfare of doctors over the last few months. You know, centre to nearly all of our discussions is how we can ensure that we are supporting the workforce, and that is so refreshing for a regulator. And I just want to personally thank you for that. It's really important. So we're almost at an end, and appreciate there's a lot of people with us. We haven't been able to acknowledge everybody or even mention your names, but thank you all for taking the time. But the last word, as is often the case, goes to Viju, who does an incredible amount of work, both front and centre of stage, but also behind the scenes to support the BAME workforce. It's been a privilege to work with you over the last few months, particularly Viju, and I think you want to give a vote of thanks. The stage is yours.
Thank you, Nick. We're now at the end of what's been an engaging session. It's indeed my pleasure and privilege to express the vote of thanks on behalf of BAPIO Wales. I believe that this memorandum is a landmark achievement which will encourage a purposeful collaboration between our health board and BAPIO. This is going to foster goodwill and positivity among all staff, particularly those from ethnic minority. Need I emphasize that a happy, well-motivated and supported workforce is bound to deliver the highest standard of care. I'd like to thank Baroness Eleanor Morgan, who's left but spared a valuable time to be with us today. A thank you for her efforts and engagement in a previous role, and we look forward to work with her and stand by her on the road to recovery from this pandemic. I thank Medical Director and Deputy Chief Exec, Nick Lyons, for not only encouraging this endeavour wholeheartedly, but also supporting its execution in a meaningful manner in the form of launching the peer support group and other initiatives, which provides pastoral care and support to all staff, including those from ethnic minority. In doing so, Nick, you have reiterated the core values that our organization stands for. Professor Longley, as usual, it was a pleasure to hear you and thank you for your wise words. I'd like to express my thanks to the GMC and Sarah Mosley in particular for engaging and acknowledging the difficult decisions the staff and doctors have had to take in these tough times. It's really refreshing to hear such words from the regulator. Thank you. My sincere thanks to Dr. Ramesh Mehta, President of BAPIO UK, for his steadfast efforts and enthusiasm towards the cause of equality and inclusion in the NHS, and Professor Keshav Singhal and Dr. Harsha, Chair and Secretary of BAPIO Wales, for their vision and able leadership, which has helped to bring those efforts into fruition today. This MOU is a team effort, and I'd like to congratulate the team on both sides, the Health Board and BAPIO. Last but not the least, I'd like to thank every leader, colleague, and friend from the Health Board, the BAME Network, and NHS who have attended this event and shown their solidarity. Thank you very much.
Thank you, Viju. Thank you very much, and thank you, colleagues, for joining us today. And the journey now starts, and we now have to live that commitment and make a real difference to the population we serve. So thank you all very much. Diolch.
Thank you.